morning. My name is Richard Wexler, and this is Caring in America, the podcast for caregivers and care recipients. Well, we have a great conversation this morning, a great guest. Her name is Ailene Gerhardt. She's an independent board-certified patient advocate, a certified senior advisor, a solo aging expert, and founder of her national patient advocacy practice, Beacon Patient Solutions, LLC. Ailene's dynamic advocacy work includes a focus on solo aging. This expertise led in the fall of 2021 to the founding of the Navigating Solo Network, a national website, network, and online clearinghouse featuring resources specifically for the solo ager. Are you there this morning, Ailene?
I am. Thank you for having me.
You're very welcome. Thank you for joining us. Where are we talking to? Where are you sitting, ma'am?
I'm based in Boston, Massachusetts.
Very good. How's your weather back there today?
Mixed. Nice and warm, summertime warm, with a little bit of rain, some humidity, usual summer fare.
The usual in Boston. Well,
Exactly.
I want to start by asking you a few questions. Can you explain what an independent board certified patient healthcare advocate is and what the qualifications typically are for that?
Sure, it's likely that many listeners have not either heard of or worked with an independent board certified healthcare advocate. So it's a great question to start with. We are professionals who help patients navigate the complexities of the healthcare system. We help people make informed decisions and ensure that their needs and preferences are heard and respected. Typically, an independent board certified patient advocate has certification from a recognized body like the Patient Advocate Certification Board. And often we come to the field from either a personal experience and or professional experience in healthcare, in social work, or other related or allied field.
Very interesting. I have not heard of someone like that before. I'm not sure if my listening audience has as well. They may be ahead of me, which is entirely possible. So what's the value in working with a board certified patient advocate? How can that possibly brighten or better the healthcare experience for clients and those around them?
Well, having an advocate on one's team, someone who is outside of the emotional or other connection to the patient, or in my case, the client, um, gives an opportunity to greatly improve that experience navigating healthcare by providing some personalized support, being able to clarify medical information that's being delivered. We're not people who offer medical advice, but we understand what clinicians are sharing with clients and certainly know reliable resources to learn more, beyond Dr. Google, of course, and which is not always a reliable resource, to help people communicate and coordinate that communication with their care team, and to make sure that the client's goals and preferences and values are being advocated for, and again heard. So this support not only benefits my client slash the patient, but also really extends to the client's support system, if that's something that's available, by reducing stress and making sure and ensuring that everyone is informed and involved.
Very interesting. And folks, we're about 8 minutes into our conversation this morning, and I know. Hold on, buckle up. I'm about to mention my four-letter horrible word called plan. But since most of us, including my wife and myself, don't do that, and then something happens, mom, dad, grandparents wind up flat on their back and really don't understand this new world that they're in, which probably starts with a hospital. I can see how valuable this is. So let me take that to a little different question. With all your experience in healthcare advocacy, what brought you to working with Solo Agers?
It's a great question. So, um, over time and in my experience since being a board certified healthcare advocate since 2018, um, and also offering community education workshops, I really noticed a highlight in gapping for support for individuals without a reliable support system. So people who are without the support of adult children or other family members. And for me, that's the framework of a solo ager. And that can be a whole continuum of folks. But recognizing the challenges that solo agers face, such as that lack of a built in support system, I was really curious and inspired to focus on providing some specialized guidance and resources to really help solo agers navigate those complexities in the healthcare system and beyond, of aging independently.
So let's talk about this for a second. And I talk about this word a lot. It's a bad word called assume. We don't want to assume.
Right.
But we assume there's adult kids out there. Mom, dad, grandparents get sick, there's adult kids. But let's look at a situation where she's not mom, she's an 80-year-old lady. Her husband has passed. You tell me if I'm kind of narrowing in here on what we're talking about. She had no children, and now something happens to her. Is that a solo ager?
Sure. So it can be someone who exactly is formally married or partnered, is now a widow or widower. It can be someone who has not married, who's single, someone who's currently partnered, but yes, is without that support of adult family members, be that children or other extended family members. And so they're navigating a lot of these pieces of aging on their own, having to make intentional choices about who's a part of their support system. And just going to that word assume, which I like to sometimes change to presume, right? What we're also finding as people age, and I'm sure this comes up in conversations with your guests and in the work you do, is just even if we presume that adult family members are available, they may or may not be willing or able to assist an older adult as they age. And so while I have a focus on providing resources specifically for that intentionality for solo agers, I often find that the work I do certainly applies to everyone as they age. It's just that for self identified solos, they really have to, again, have that intentionality about who they bring into their support system.
I find that very interesting, and I obviously agree with you. Again, presuming, we hope if there are adult children, they get involved with mom, dad, grandparents. But as I've talked about a lot in previous episodes, and I know most of us don't live near where we started with mom and dad. Usually it may be a move because you met an individual, married them, they became your partner. It may be because of a career. It may be both. You could be hundreds of miles away, you could be many states away, or you could even be out of the country. And what you were just talking about, that she is mom, she's 80 years old, but there's no one really to help support her and guide her through this very tough time. In talking about that, what are some of the other challenges that solo agers go through and experience?
Well, when it comes to navigating the healthcare system, which is complex for anyone and everyone, even those of us who are well steeped in navigating the healthcare system, uh, there are difficulties in making healthcare decisions, because if you are someone who lives on your own or is does not have as robust a support network as they would like, being able to talk about healthcare decisions and managing complex medical conditions, having someone to go with you to take notes at a medical appointment or other kind of appointment, or help you prepare for that appointment, or even discuss treatment options. Right, as a clinician may provide different options for us, and then we ideally decide based on our own values and how it impacts our quality of life. If we are limited in who we're able to discuss that with, that can be a barrier to how we make decisions, and sometimes can be a barrier to a healthcare outcome. I always give the example of a colonoscopy. If you don't have someone to sign you out of a colonoscopy, it's well known that that cannot be a cab driver, it cannot be an Uber or Lyft driver, right? It has to be someone who is able to sign you out and make sure that you've arrived back at your home space safely. If you do not have someone to provide that, and again, that impacts solo agers, but it impacts anyone in a daytime, right, medical availability window, you may put off going to that screening appointment or preventative screening, in this case, a colonoscopy, which can affect a health outcome. So there are things like that. There are pieces of different ways of uh, coordinating communication among one's healthcare team, that all of those different pieces, when you have limited access to others to help, we know that being a patient, even at an annual visit, is a full-time job, right?
Yeah,
And
yeah.
so it's hard to take everything in and take accurate notes and remember what was said and all of that. So having that support can make a tremendous difference. And that's often something that people who identify as solo agers find as barriers in navigating those pieces.
I find that very interesting, and I think about my own life. I'm a fairly educated individual. So when I'm younger and in my 40s, I'm in my 50s, sometimes going to the doctor can be challenging. And based on their bedside manner, I mean, they may be talking about things from a scientific standpoint that are going totally over my head. And as we age and we get into our mid and late 70s and into our 80s and beyond, I can certainly see how that can be even more challenging unless you have a formal medical education yourself to understand this and understand all the different things that are going to happen in a hospital process and why the value of having someone with you. And I think you said this early on in our conversation. You maybe in the situation we're in, there are adult children. Maybe those adult children aren't the best to be having with you in healthcare appointments and so on and so forth, and speaking with the doctor. And this advocate can be doing some fantastic work to really help you and take some of these complexities out of it. In all the time you've been doing this, my guess, and I could be wrong, that you've probably seen some success stories. Do you have any you can share with our audience?
Sure, I am fortunate that that I have seen success stories, and really, I really recommend to people, whether you have the ability to engage a professional advocate, but even if you're just someone listening to this, thinking about how you approach healthcare appointments in general and supporting anyone navigating those, having someone with you to again be able to take notes, right? That patient is the star of the show. The advocate, whether professional or someone accompanying through a friendship or family connection, is a supporting cast member, right? The patient is the focus, but it's really important that the clinician interact directly with that client, or my client, their patient. And so, in terms of success, people often, uh, unfortunately, will receive a diagnosis, something involving cancer or oncology. And there are all these stories told that when that occurs, everything else that comes after that, is sort of referred to as sort of as a Peanuts cartoon, right? There's sound, but you don't really hear, because you're trying to, as a human, absorb what's going on. And so when someone receives a diagnosis, when someone is hearing about information in different ways to make an educated decision for themselves, I've been fortunate to be a part of the team. And so I had a client who identified as a solo who had a new cancer diagnosis, and learning the navigation of how one coordinates with their care team and how you identify reliable information about the diagnosis, right? What's available to you from the clinician? What are some websites and organizations locally and nationally that could benefit you? Right? This is a whole new world when someone receives a diagnosis. As you mentioned, we don't speak medical ease if that's not our professional training. And again, when you're a patient, there's an emotional level, there's a human level. All of our best skills kind of go out the window because we're human and we're trying to understand the information in that way. So helping someone coordinate their care and maximize connections to their care team, helping plan appointments, connect with the scheduler for that, or the nurse navigator that's often connected when it comes to oncology diagnosis. Attending appointments really helped that person, preparing for those appointments, taking notes, reviewing those notes, helping them understand treatment options and where they might go to look for that, and also exploring. And this is a part of this idealism when we look at healthcare, but ideally, our healthcare should reflect our quality of life and our values. So if we're presented with a few treatment options, it's good to be guided to think about, how will this affect my quality of life? All things being equal, and that's not always the case, will one prevent me from driving and one give me the ability to continue to drive and be able to continue to support a family member going through their own navigating healthcare, or children who need, care as well, or transport to and from, sports team and club activities, that kind of thing. What are the pieces that are important to me? And so I, as an advocate, am able to sit with a client and help them flesh some of those things out. I don't make decisions for anyone. My product is information, but helping people flesh those things out so that they can then make an informed decision for themselves. And so being a part of a client's team, when there's a diagnosis like that, I have seen significant reduction in stress, because they know they have people to rely on, and to be able to manage their treatment process. So that's really a kind of situation that stands out for me.
Fantastic information. Kind of have a two-part question. How do folks find a qualified board certified advocate? And then the second part of that, again, maybe I'm wrong, that it may be difficult if our 80-year-old lady is flat on her back in the hospital to engage with someone like you. When should they be reaching out?
That goes back to your favorite four-letter word, right? Plan,
Yes,
right?
ma'am.
So in an ideal world, we would love for everyone to be proactively planning, right? It saves stress. It gives you the opportunity to vet professionals you want to work with, not at a time of crisis, all of that. But we also recognize everyone's human. And usually the spark is some kind of reaction to a situation, whether it is a crisis or just a first time navigating something significant with the healthcare system. And so the part of when is, you know, really think about who might be useful over time as a part of the navigating caring team, right? Those can be attorneys, those can be financial advisors, healthcare advocates, care managers, et cetera, et cetera. And there are many more professionals to add to that list. But ideally, think about that after hearing this conversation or other great episodes of this podcast. Hopefully, that'll prompt that. So, because again, that gives someone the opportunity to really ask, questions of different professionals. As with anything, you know, everybody has to be a good fit, right? I have to be a good fit for the prospective client and vice versa. And so asking questions like, what is someone's qualifications and certifications, experience, in the type of healthcare advocacy that someone might need? What are the ways that the individual communicates? How are clients kept informed? Can support system members be part of that? What are the fees and services? Independent healthcare advocacy is an out of pocket cost because it provides direct advocacy and independent advocacy for the client. But it is good for people to be aware it's an out of pocket cost. And then where to find reliable resources about healthcare advocates, some directories. Two organizations I like to recommend. One is the Patient Advocate Certification Board, which has a list of board certified patient advocates since 2018, which is the first board certification cohort, and the National Association of Healthcare Advocacy both have directories on their websites, and I can certainly provide those for show notes and all of that. So those are two great places to look for someone who has the type of specialty or need that you or somebody you are supporting may have. And keeping in mind that now, with the advancements in technology, there are many, many advocates who work with clients, as I do, all over the country, even if we're based in one particular location. There are some people who are completely locally based, and many who do a lot of work nationally, which, for the most part, except for direct bedside work, works out with really great outcomes for clients as well.
This is, again, fantastic information, folks. As we get ready to wrap up, final question. If people want to get in touch with you, phone number, email, website, what would you like to give out?
Sure. So, my business, as you shared at the beginning, is Beacon Patient Solutions. And the website is www.beaconpatientsolutions.com. You can also send an email to info@beaconpatientsolutions.com. And my phone number is 617-651-2140. I also have on my website a way to make a complimentary brief consultation appointment by phone to get a sense of what someone may be looking for. And also keep in mind that as advocates, certainly board certified patient advocates, we adhere to an ethics code and a competencies code. And so if I'm speaking with someone in that initial conversation and I know of an advocate who sounds like they would be a better fit, I will refer out. And so will my colleagues. So, because we want our clients to have the best possible outcome they can. And so to do that, we really are connected around the country to know what kind of work different people are doing in different places and their specialties.
Once again, this has been a fantastic conversation. We want to thank Ailene. Folks, like I say on every episode, if you want to get in touch with me, you have comments, you have questions, you'd like to be a guest on the podcast, email eldered2023@gmail.com. And as I say on every episode, until we talk again, have yourself an awesome day.